CTV News at 5 with Hudson Mack.
Good evening. Thank you for being here. Tens of thousands of British Columbians have signed a petition demanding that the province improve care for children who are suffering from mental health issues. Imagine if you were worried that your teenager was suicidal, but you were sent home from the ER with a prescription. Well, today a group of parents met with the health minister demanding changes to a system they say is badly broken. CTV's Stephen Andrew reports.
These parents are carrying a cry for help. Close to 37,000 names on a petition demanding the province improve emergency services for children with mental illness.
I hope the minister will actually have a policy and protocol put in place for kids who come into hospitals in crisis.
Owen and Kelly Bradley launched the petition after many frustrating visits to the emergency room with their daughter.
We ended up at the hospital via police 3 times, and 2 of those occasions she was sent home on a sedative. And the first time she was only there for 4 days so they could rule out any physical reasoning behind her mood swings. And when they realized it was her bipolar that needed overhauling, they gave us a wait list to go to a psychiatric hospital.
The Bradleys and other parents say that level of care is unsafe, leaving parents to deal with a mental health crisis without support.
It's, to me, again, like asking a parent to take a child home with a broken arm and say, well, you can deal with that at home. You can set the bone at home and then come back in if it gets serious again. We don't do that, and we need to treat mental health that same way.
BC's health minister met with the group for just over an hour today, and the parents say they are happy with the meeting.
The health minister acknowledged that there's some huge gaps and that there's a huge need for improvement.
2 improvements the Bradleys felt the minister understood: the need for a child psychologist to be on hand to admit youth to hospital, and the need to consult parents before their child was released from care.
But while the parents believe their meeting with the health minister today may soon bring about some real change, the government appears to see it otherwise, more of an exchange of ideas and information.
While I understand that that is what they would like to have happen, I think most of the parents left understanding that around the whole province we would not be able to do that. Child psychiatrists are critically important, but not every single small hospital. Like the small hospital that I used to work at in Trail will never have a child psychiatrist, or at least it's very unlikely.
With an election call less than 2 weeks away, these parents are targeting the opposition as well, now turning their attention to the NDP. Stephen Andrew, CTV News, Victoria.